Hi, ma'am. So today we have with us Miss Sandhya Senthil, ma'am, and this is part of D.O.R.A.I Foundation's Health Fest initiative. It is a sort of an awareness program, and here this year, this May, the interns at D.O.R.A.I Foundation, we have been interviewing individuals with varying disabilities, disorders, and other physical illnesses. And we're trying to understand the psychological effects of having such injuries. And the topic at today, the topic is brain injury. And so the interns at the Rai Foundation, we have interviewed with such people, and we're presenting the case today to resource people who can then like give us a little more insight. Thank you very much for agreeing to do this with us, ma'am.
Thank you so much. Thank you so much for the opportunity.
Yes, ma'am. So the topic today, like I said, is the psychological impact of brain injury. So now, personally, when I have done the interview with the person, she is 20 years old right now. She was a basketball player, but had to quit her journey when she was 13 years old. She had a head-to-head collision with one of her teammates during practice. She was a national player, and she had to quit her basketball career altogether because of one single thing. So before we dive into the specifics of the case, ma'am, I would like to ask you, how important is it for any person, for that matter, to test their condition immediately after an injury to the head? Sometimes people tend to ignore saying, "Ipdi rub panna, idu panna," or doing that it'll be fine. But how important is it for anybody to have follow-up checkups just in case?
Yes, be it any kind of injury, I think early diagnosis is very, very important. That must be that must top the priority. Especially when it's a head injury, I think we should never delay the diagnosis. Okay, the clinical assessment, basically just talking to the doctors as to this has happened, and what are the kind of complications or anything that they must be given a heads up.
Yes.
As to what are the kinds of assessments or tests or the follow-ups that they need to be doing after the injury. So I think that is the most important step. As a special ed, we keep talking about early intervention. Early diagnosis is the key. It is very important. It should never be delayed.
Yes, ma'am. So, according to you, what are the signs and symptoms to look out for? For example, in this particular case, she did not have any immediate swelling on the head, but there have been certain problems that she witnessed after 2 weeks, right? She did not visit the doctor because there was no visible swelling, and she later saw like disturbances in the movement of her left side of the body because the injury was on the right contralateral. So that's how important is it to look out for at least signs if you're not really visiting a doctor because it is not physically visible outside.
I think we should look out for the smallest of signs, especially I think when there is an injury and the processing is slow, it is going to affect the motor skills, the gross motor skills, the coordination. We talk about left and right brain coordination. I'm pretty sure they would this particular child would have uh, 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 been able to see some changes in her movement. So I think it it could have been ignored, or it could be maybe it was taken in a light sense. So I think yes, there would have been very small signs. And I think she was just a teen, no? She's 13
Yes.
when this happened. So I think parents also must be extra vigilant especially when there is there is a collision, as you said. They could have been a little more vigilant. I think it is very important that they look out for the smallest of signs. Yes.
Yes. So people recover from all sorts of injuries and all kinds of minor stuff like a scrap or such stuff. But how is recovering from a head injury different from the recovery of other kinds of injury? Because most often, like how you just mentioned, motor skills are disturbed, and in this particular case, she had there was a change in her walking style. So the physical appearance also changes. So with taking into consideration such attributes, how is the recovery process from a head injury different from other kinds of injury?
Head injury, I think it is the most serious kind of injury, no? Because it can affect your cognition, your thinking, first of all. And then your brain coordinates the entire body, all the bodily functions. So I think it shouldn't be taken for granted, or it should not be delayed. The diagnosis should not be delayed. It can have multiple effects, and as you see, it took its own course of time to show the first symptom. So I think that way, although the symptoms were not very physically evident, they should have we should, I should say, be more vigilant and observe what's happening to the affected person.
Yes, ma'am. In this particular place, or generally speaking, when a person is extremely independent, very career oriented, achievement oriented, she wanted to become an international basketball player someday and
Mhm.
pursue her dream of becoming a doctor. And unfortunately, due to the limitations caused by the head injury, she could not keep up with the academics, because not because her cognition was affected, but because she had to often go visit the doctors. There was
Right.
physiotherapy. She could not give all her time in that particular stage in life. She could not give all her time to her academics as demanded by the field of medical, the
Mhm.
medical. She had to step away from that, and that's when she chose her BSc psychology, and because it was, in her opinion, remotely closer to her dream choice of career. And being such a person who is very self-assured, she knows what she wants in life. When there's a sudden change that occurs, everything seems uncertain, right? And now she is heavily dependent on other people. And this causes a lot of frustration for any individual for that matter. And the
Right.
need constant need for someone to be there in the environment to actually support her, it's very hard. So how does this frustration that arises from not being able to cater to her needs by herself and being independent, how does this affect her psychologically?
um, Definitely self-doubt. It affects self-esteem. And then, as you said, doctor spoke about her physical changes. It affects her body image. And for a teenager, I think that's the first uh, thing that can demotivate
Yes.
an individual, because they're very self-conscious, and that's the stage that they start becoming independent. So when that's being taken away from her, it will certainly affect her self-esteem. Without self-esteem, you have this worthless feeling when your self-doubts arise, and they are not sure about what's going to happen after that. it is going to bring them to ground zero. And then maybe if they're going to work on their mental state, I think it will take some time for them to start building the self-esteem again, and then focus on their other strengths. In this case, this particular child was a basketball player. Maybe the other strengths that she had, definitely she would have had the other strengths. She can be encouraged to work on those strengths.
Yes, yes, ma'am. Thank you for answering that. Most often when changes happen, especially when you're not able to accept the changes yourself, and when you meet with other people, you are most often afraid that, for example, in this case, her walking style is different. There is some sort of partial paralysis due to the surgery that she underwent to remove the blood clot caused by the brain injury. She often fears that people tend to look at the appearance first and then
Correct.
to get to know you. So whenever in a particular discussion or in a particular situation, she was not given an opportunity for no matter what the reason, she always thought it is because of her injury or it is because of the way she looked. And it is often and unfortunately common for people to actually do that. But she tends to do it in cases when it is not really about her injury. She refrains from rationalization. And like you said,
Mm.
this could impact her self esteem and her ability to be self assured, her confidence levels. And she stops herself from doing and learning new things or entering into new environments. She puts a limit on herself rather than somebody else doing it for her. So, in your opinion, considering such circumstances, how important is rationalization?
Uh, yeah, I thought I lost you. Sorry. Yeah, I think it's very important that the affected individual be put into therapy where uh, professionals would give her the assurance and maybe guide her that such judgments are very common. It's not just whether you're injured, whether it is your physical appearance, whether you uh, whatever it is, even if you are the most normal of person, you're going to be judged. So it doesn't matter. It doesn't matter. I think we should work on building her self-esteem. That is, if I'm the affected individual, I should be probably investing my energy and harnessing my energy in building my goals, my skills, and building my self-esteem, building my confidence. What I have lost, no matter what I'm going to do, people are going to judge me, right? So I think we have to give her the confidence that it's okay. It's okay to be different. It's okay. Everybody has a weakness. So I think we should motivate such people to um, build their self-esteem, their self-confidence, give them the assurance that nothing has changed.
Yes, ma'am. All these are external to her, but approaching a therapist or seeking help from other people from the environment. But the most disturbing of it all comes from when the such feelings stem from within you. So how can she block the self conflict that she has within herself? That she's capable, but she's also not capable. She's not good anymore because of her injury. She has changed. She's not able to do things like she did before. So, how can one control that aspect of self conflict within oneself?
I think these support groups they meet people with the similar kind of problems. Meeting with such people, socializing with such people, it enables them to self reflect and maybe feel better that we are not alone, and it is okay, there are other people suffering, and they assuring each other, giving assurance to each other. I think this would play a very important role in their lives, in socializing with such people, or with the counterparts, with individuals with the similar kind of issues. So I think that's a very good way of uh, uh, for them to overcome the challenge, as you said.
Yes.
Yeah.
So the last question of the day, how important is accepting oneself the way they are, or accepting the changes that occur? Uh, how important is accepting in such conditions and circumstances?
Yeah, acceptance is, I think, the first most important thing. No? That before assurance, I think acceptance is very important. No matter what it is, whether whoever you are, whatever profession you are going to take, what kind of lifestyle you lead, all these, acceptance is the most important factor that is going to keep you going. No matter what you do in life, you are definitely going to be in need of something. You're never going to say, I possess everything, I have everything. No, every time, every day, you'll have something that you are in need of. So accepting that, accepting yourself, accepting that moment, keeps you happy. And being happy is very important to achieve your goals. It can be not just very high goals, your day-to-day routine, your day-to-day goals. Keeping yourself happy keeps you going. So that's the most important fact.
Yes. Thank you very much, ma'am. And thank you very much to allow us to see how important acceptance is in order to move forward in life and to actually not put a limit on yourself. Because I believe once you accept the changes that take place, or you accept the things that have already happened, it helps you see forward. It helps you
Correct.
think more creatively and understand that it is not the end, and you can actually put your strengths and abilities into something else and nurture that better and develop in that manner. And I thank you for also letting us know how necessary it is to not ignore anything that actually happens to the body, be it physical or mental. And I think intervention at its earlier stages is extremely
Yes.
important for the well-being of the person. And once you try to understand and look into yourself, you tap into yourself, you can identify where your anxiety, where your self conflict actually stems from. And it takes a lot of time for us to actually do that. But once we're there, it's a journey, right? And once we're there, we'll be able to develop ourselves better in our lives. So thank you very much for being here today and sharing your insight, Mom. It was very, very, very helpful, and I'm sure the viewers will find it helpful as well. Thank you very much.
Thank you so much. Thank you so much. I had a very beautiful time trying to understand what you people are up to. It is, I think you're all doing a great job. Uh, all the best,
Yes.
and keep doing what you're doing, and keep inspiring everybody. Thank
Yes,
you.
Mom. Thank you very much. Thank you.